and we'll be going through the introduction, the problem statement, the real world insights, the solution, and then the demonstration. So basically, I already said this, but I've always been interested in health and like business, but I've never wanted to like handle like patient or like the science part of it, and I've always been interested in like business and marketing, and I thought that was like a good combination of both of them. And so that led me to want to major in healthcare information management or something similar to that. And I've always also been interested in how AI can like help things make go smoother in the business side of healthcare, or like how can I like make my tasks easier. My problem statement is like navigating the US healthcare system can be very difficult, and the US prescription costs fluctuate wildly depending on commercial pharmacy deals, drug tiers, and deductibles. And the patients rarely know their actual out of pocket costs until they reach the pharmacy counter, and then the pharmacist tells them how much it is. And not knowing how much they're paying can lead to financial strain on the patient, or even make them skip doses to save money on their prescriptions and medication. So, my application Care Cost Insight was designed with these problems in mind to help everyday families and be transparent with everything that comes with the medical world. So, for my real world insights, the healthcare costs and medical debt remain leading causes of personal bankruptcy in America for like many people. And clinical notes and medical terminology can leave patients feeling confused and unable to correctly understand their own issues or like medical reports and stuff. And many don't know the prices of certain medications or even where to buy them in the first place. And medical or insurance support may not be localized and can be hard to find. So, my solution is my application. And it includes many features such as the pricing minimizer that simulates brand versus generic pricing gaps and shows pathways like manufacturer coupons or steps to take in the future. Carrier rules, which cross reference pre existing conditions with major insurance companies to find the hidden problems within the plan. And decipher terms, explains medical terminology in everyday words, and provides next steps to take. So I will go to my demonstration. So this is my homepage for my website, and on at the top it gives you a little description about the application itself, and it like how it's made for people who like want to know more about what they're doing and who are feeling stressed at the moment about any medical thing. And it says like who it's made for and what it offers. And then below that, it talks about the 6 core services: the pricing minimizer, decipher terms and reports, state assistance map, camera scanner, carrier rules, and public screener. And below them, we have like descriptions of each, and you can hover on like whatever feature you want to click on it and go to the feature. And on the side here, we have the healthcare system guide, which talks about the Affordable Care Act, formularies and drug tier models, the high deductible health plans, and direct generic formulations, and gives like descriptions for each. And then at the top here, I'm already signed in, but you can sign in with Google as well as to like, save all your information and stuff. So now we'll go to the first feature, pricing. Okay, okay. Here you can pick medication name, the dosage, and the plan. Oh, I keep going.
Do you want me to say any medication?
No, I just didn't. I thought you left the call.
Oh no.
um, I was saying that you could choose the medication name and the dosage, and then the insurance plan. Um, do you want to like? Do you have any like example you want me to like show? like any medication or like dosage you want me to put?
Yeah, yeah, sure.
Should I'll just put the example. Sorry. And then we'll just pick the standard plan. And then here you can click the generate option and it'll generate the analysis for you. Here we have the cost breakdown. So we can look at the brand name or the generic and it'll tell you the price, but like the insurance copay, the average retail price and all that stuff. When we go down, we have the price gap comparison. It gives you the comparison and like how much you expect to pay per 30-day supply. And then below that, it tells you the advice. So since there is like a huge price gap, you can save a lot just by switching to the generic one. There's coupons you can use. There are a lot of options that it provides that you can use to minimize the cost of the drug. For a camera scanner, you can, if you have a medication bottle that you don't know the name of or like what it does or how much to take of it, you can take a picture of it and it will analyze the label for you and it'll just tell you all the details that are for the medication. For decipher terms, you can put in, see, I already have epithelial tissue here. You can put in terms that you want. If you don't know anything that, say, is on a medical report, you can put the terms there. Or you can also pick a file from like your files and upload it, and it'll decipher any terms that may seem hard or like people won't usually know. So here I have epithelial tissue, and we can click on decipher, and it'll give you the regular like everyday explanation um, and the anatomical expression, and then below it tells you about what would uh, it be like for like on a medical or clinical report and how it can be important. Um, and then here it tells you what to do in the future, ask like questions to your clinical provider and what you should do to like, take care of your like epithelial tissue and like just to like mitigate like cancer, like the risks that you can like get from not taking care of it. For carrier rules, you can put in any diagnosis you want here and you can pick a carrier. And when you pick the diagnosis or the carrier and click check carrier guidelines, it'll tell you whether your carrier will give you good care, like good enough care for your diagnosis. So I put asthma here. First, it tells you about the Affordable Care Act and all the protections you get with your carrier. And below, it tells you that here um, Blue Cross Blue Shield is prohibited from denying coverage, but some of the protections there still may be barriers for asthma specifically, and it'll tell you everything about that. And then also tells you what you can do to like mitigate the barriers and the limitations that come with having that carrier and having that specific diagnosis. For state assistance, you can click any state here that's most closest to you, that's local. And for example, if I click Texas or Florida, sorry, um, and click the button, it'll tell you state programs for like insurance and like medical insurance. And it'll give you a bunch of local programs that you can go to without having to like, worry about if the program's local or not. If you're like looking up insurance programs and it's in Texas, but you're in Florida, it'll give you like these programs that you can go to locally. And our last feature is public screeners. You can put your age, the household volume, and your annual like gross income, and say let's change this and see like the check the eligibility for Medicaid or Medicare or federal poverty level. So here it will go over your parameters and what you have, and it will tell you that um, you may be eligible for Medicaid. And then down here, it says because the person's 65 years old, they are eligible for Medicare. So it goes through all the steps to enroll in it. Basically, this tells you whether you're eligible for like a Medicaid, Medicare, or like the federal poverty level. And that is my application. Thank you.
Great. The application looks really neat. And if you have anything left with the presentation, you can do that. Otherwise, we can start with questions.